Hello and welcome to the webinar on air quality and carbon monoxide. Our speakers this evening include myself, Paige Kizior, Healthy Learning Coordinator with Women for a Healthy Environment, Dr. Danielle Samasa, Associate Director of Early Learning in Southeastern PA, Jermaine Patterson, Certified Community Health Worker who has worked with Women for a Healthy Environment for many years. Her work focuses on air quality in the Mon Valley in the Pittsburgh area with an emphasis on advocacy. And we have Dr. Jessica Rice. And this webinar is co-sponsored with the Philadelphia Regional Center for Children's Environmental Health. So let's all welcome Dr. Jessica Rice. Dr. Rice is an attending physician with the Division of Pulmonary and Sleep Medicine at the Children's Hospital Philadelphia. She is also an assistant professor of pediatric pulmonology at the Penn Perelman School of Medicine. Dr. Rice's research focuses on the indoor environment as a modifiable risk factor for pediatric lung disease. Her short-term goals are to investigate the health effects of indoor air quality in the homes of preterm infants. Future work will develop, implement, and evaluate the health impact of an intervention to reduce indoor air pollution in homes of infants and children with chronic lung disease. So first, I want to introduce Dr. Danielle Samasa, who will begin our session with her personal experience with carbon monoxide poisoning.
Thank you, Paige, and good evening to everyone. So I wanted to open up this conversation on carbon monoxide poisoning, how I became so passionate about it. Oftentimes we become passionate about something when we have a personal experience, especially when it comes to things like environmental health. So just a little bit of background. I live in Philadelphia, and I live in the Overbrook section, which is right outside of West Philadelphia. If anyone know about this area, the houses are old and they're big. So my house is about a little over 100 years old. I've been here for 22 years in December. And a few years ago, our local gas company, PGW, were changing over meters throughout the city of Philadelphia. So it was mandatory that in order for them to do it, they had to come in. Most meters in Philadelphia um, are in the basement. So they were moving it from the basement to outside. Um, and so I had been putting it off them coming out because, they give you like a 6 hour window. And it was the dead of the winter, and I'm like, oh, okay, yeah, I'll have them come out when I can. But in the meantime, I had noticed that I was starting to suffer from severe headaches at night. And these weren't normal headaches, and this was probably in 2018. So this was before the pandemic. So I'm like, I've had migraines before, but I remember telling a friend prior to PGW coming out that I thought there was something else going on because I was getting these really, really bad headaches particularly at nighttime. So the guy comes in, a younger man. He comes in and he goes downstairs and he said, "I'm going to test for carbon monoxide." And I said, "Go for it." And I literally watched this white gentleman turn whiter. He looked like a ghost, and he looks at me, and the first thing that he says is, "I am surprised you are not dead." So to find out that I had deadly levels of carbon monoxide in my home due to a stuffed chimney. So the vent was all clogged up. It hadn't been cleaned out in years. And so it was just building, building, building. And because it was the dead of the winter, I had turned the heat on. And the only thing that had saved me is that, again, I live in an old home with radiator heating. And so it gets really hot upstairs. So I tend to leave my windows open during the winter time. And that is the only reason why I'm here and able to tell the story today. The city immediately stepped in. I now have carbon monoxide detectors as, of course, as well as fire alarm detectors. But it was something that I just never considered. You know, I never thought about in making sure that I am safe and that my cats are safe and that my family are safe and people are safe that are here. And, you know, it's particularly just as in Western Pennsylvania and Pittsburgh, here in Philadelphia, most of these homes are old. So it is something, or structures are old. Child care centers are particularly in older buildings. So it is something that we all need to do a better job of paying attention to. Each year, we have at least 1 or 2 deaths here in Philadelphia due to carbon monoxide poisoning. I think it was in 2023, a whole family died here in Philadelphia due to carbon monoxide poisoning. So it is a serious issue to address. And I love the fact that we have the opportunity to do so today. So that is my personal story. And I am going to now turn it over to Dr. Rice.
Well, thank you, Dr. Samasa, for sharing that. That is an incredible story, and unfortunately, right, not extremely uncommon. And you had no idea you were being exposed because, as we will go through, some of the risks of this are that you don't even know you're being exposed potentially. And I learned some things putting this together as well, because as a pulmonologist, I'm not necessarily seeing carbon monoxide poisoning in regular pulmonary clinic. These are usually managed in the emergency department. So it made me think about these issues as well for my home and childcare centers in the area, and for always being alert to symptoms. So to think about this. So first, what is carbon monoxide? Carbon monoxide is an odorless, tasteless, colorless, toxic gas formed by combustion. And then carbon monoxide poisoning is when too much carbon monoxide builds up in a person's blood. And this can cause suffocation because carbon monoxide stops oxygen from moving through the body. So it can't be seen, can't be smelled, can't be heard, but it's important to have detectors. So carbon monoxide is a poison gas that is a byproduct of appliances, heaters, and cars that burn gasoline, natural gas, wood, oil, kerosene, or propane. Indoor sources, there are many, include fireplaces, wood stoves, coal or oil furnaces, space heaters or oil kerosene heaters, charcoal grills, camp stoves, gas-powered lawn equipment, power tools that you wouldn't necessarily think about, car exhaust fumes, portable generators, ovens, gas stoves, water heaters, gas clothes dryers, lots of sources potentially in the home for producing combustion and being a source of carbon monoxide. And so what are the health effects of carbon monoxide? And Dr. Samasa did touch on some of these things. Carbon monoxide has come to known as a silent killer, unfortunately. Clinicians must be alert to the signs and symptoms of carbon monoxide toxicity because it accounts for most of the poisoning deaths in the US. Approximately 430 people die each year from carbon monoxide exposure, and exposure leads to about 50,000 ED visits in the US each year. Carbon monoxide poisonings often occur during power outages related to natural disasters, severe storms, in the winter due to unsafe use of generators indoors, in semi-enclosed spaces, or near windows and doors. And then, as we mentioned, carbon monoxide is a colorless, odorless, and tasteless poisonous gas. And so symptoms of exposure are, and unfortunately, the symptoms of exposure are also kind of nonspecific and maybe subtle, especially with low level concentrations. And so this dangerous exposure may go unrecognized. Once inhaled, carbon monoxide attaches to hemoglobin in the red blood cells. Hemoglobin is normally what carries oxygen throughout the body. When carbon monoxide attaches to the hemoglobin, it blocks the oxygen the body must have, creating health problems. So it attaches to hemoglobin more readily than oxygen can. The most common symptoms include headache, like Dr. Samasa mentioned, but such a common, non-specific, potentially subtle symptom that you're not immediately, when you go to the doctor with a headache, they're not immediately thinking about carbon monoxide poisoning. Dizziness, weakness, clumsiness, nausea, vomiting. And like we said, these symptoms can be seen with a lot of other illnesses. The flu, flu-like symptoms, viral symptoms, food poisoning are thought of most commonly first. Less common complaints with maybe higher exposures, rapid or irregular heartbeat, shortness of breath, chest pain, hearing loss, blurry vision, confusion, disorientation. At very high levels, carbon monoxide poisoning can lead to seizures, loss of consciousness, heart attack, and death. Breathing carbon monoxide at low levels regularly, though, even for longer periods of time, like Dr. Samasa was exposed to, may cause symptoms like headache for longer periods, but also the exposure to carbon monoxide can lead to delayed neurologic symptoms, including cognitive deficits, personality changes, movement disorders, that can be seen after exposure and may persist for long periods of time. And it's important to think about these symptoms. Like I said, they can be seen with the flu or other viral kind of symptoms, but if these symptoms persist, especially if they get better after you leave the home or the building, like, oh, I don't have symptoms at work or at school, but I only have these symptoms at home, that you need to think about how high index of suspicion for carbon monoxide exposure. Also, if there's a history of exposure or there are multiple household members with the same symptoms, which could also be seen with viruses, but usually with carbon monoxide poisoning, an important differential from a viral illness is there's no fever for any of the people. And so although everyone is at risk for carbon monoxide poisoning, it's particularly dangerous for children because they breathe faster and inhale more carbon monoxide per pound of body weight. So in young children, signs of carbon monoxide poisoning may be even more subtle and nonspecific than those in adults because they can't tell you what's wrong. Infants and toddlers may present with fussiness, feeding difficulty as their only symptoms or manifestations of carbon monoxide poisoning, which we don't immediately think about carbon monoxide poisoning for a baby who's kind of fussy and not feeding well. And childcare providers are in a really unique, important position because they're observing children for many hours during the day. And they can serve as the first alert in noticing a change in symptoms or a change in behavior, ongoing concerning symptoms in a child that may be caused by their environment at living at home. And so the diagnosis and management of carbon monoxide poisoning is handled in the healthcare setting in the emergency department first. Typically in the ER, where a blood test can be used to diagnose carbon monoxide exposure and get the levels of exposure. There is no antidote to carbon monoxide exposure, and so treatment includes oxygen therapy. Oxygen can be given in many different ways: nasal mask, nasal cannula, or with severe exposures, a ventilator to help you breathe, and even hyperbaric oxygen, which can get oxygen into the body more quickly. And then importantly, to get to how to protect yourself from carbon monoxide. So furnaces in the home, gas furnaces and fuel burning appliances must be installed and working according to manufacturer's instructions and building codes. They should be maintained annually by a professional. And they must be properly vented to the outside. This is important for gas stoves, furnaces. This is a picture of a furnace and gas water heater vented to the outside. furnaces, modern furnaces are, and I'm not a HVAC expert, but modern furnaces are now usually vented to the outside, but some older homes might have furnaces that are vented through a chimney through the roof also. And so those must be maintained and make sure they're not blocked or obstructed, especially from snow, ice, debris, leaves, etc. So they have to be constantly checked. And then importantly, gas stove tops and ovens should not be used for heat, to heat the home. And that is an important mechanism for exposure for potentially for families. Also for fireplaces and wood stoves, also should be maintained annually by a professional, and chimneys should make sure that the flue is open during operation to make sure the gas is ventilated to the outside. Proper use, inspection, and maintenance of vent-free fireplaces, so the kind of the gas inserts that are not wood burning, and space heaters is also recommended. And it is not recommended to burn charcoal, lanterns, or portable camp stoves indoors. If there was a power outage, people might do this, or when it's cold and there's a power outage, this might be a source of exposure. Space heaters. So this is something that it kind of pop out in the winter when it's really cold in homes that have uneven heat in the house, downstairs versus upstairs. I also have a home like that. Fuel burning space heaters should be checked professionally once a year or as recommended by the manufacturer. It's important to keep these combustibles at least 3 feet away from anything that can go on fire that is combustible. And it's important to use a wall outlet and never a power strip, and that's for fire risk. And do not leave space heaters running or unattended for prolonged periods in a confined space. Portable generators or other fuel-powered equipment also always recommended to follow the manufacturer's recommendations when operating generators or other fuel-powered equipment. Portable generators should be used outside, completely outside only, at least 20 feet away from the home, and directly exhaust away from the home and other buildings, not near any windows or doors. And they should never be used inside a home, a basement, a garage, or a shed, even with the door open, to avoid carbon monoxide exposure for that source. And then do not operate any gas-powered engines in confined spaces. So turning on the lawnmower or the leaf blower or the snow blower inside the garage and letting it run, in an attached garage next to the home. And the car, warming up the car in the garage is an important source that people don't think about. Even with the door open, the car should not be running to warm up in the garage, even with the door open. And then never let anyone smoke inside your home. Cigarettes, pipes, cigars also produce carbon monoxide. And like I said, carbon monoxide poisonings occur most often in the home. Carbon monoxide fumes produced by furnaces, kerosene heaters, vehicles being warmed in the garage, stoves, gas ranges, portable generators. These sources can build up carbon monoxide in an enclosed or partially enclosed space, so it is critical to have a carbon monoxide detector. These can save lives. Of note, I learned during preparation of this talk that they are not required by law in childcare facilities. I'm not sure about homes. I don't think they're required by law in homes either. So people don't probably even think about this necessarily. Carbon monoxide detectors, it's also important to point out that these are not the same as a smoke detector. So having a smoke and fire detector in the home does not protect you from carbon monoxide because that is not the same kind of detector. They can be a combined monitor, but it has to be labeled that way, that it can detect both carbon monoxide and smoke. I have some of those, but you can also have separate carbon monoxide detectors. Carbon monoxide detectors should be installed and maintained on each floor of the home or facility, including the basement or where there are fuel burning appliances, like where the furnace is in the basement. So it's not okay to just have one carbon monoxide detector in the building or the home. And this was focused more on childcare facilities, but for home instruction should be within, when they're on the floor, they should also be within 10 feet of a bedroom, So you may also need separate carbon monoxide detectors in each bedroom if the one for that floor is further away than that for extra protection. The carbon monoxide detectors should be replaced every 5 years or per the manufacturer instructions, and they should be checked monthly. This is not something we always think about. I installed mine a few years ago and have not checked them. So this was a good reminder for me also to check my carbon monoxide detectors. Just because they're quiet doesn't mean they're necessarily functioning. And then if you plug some of these detectors come where you can plug them into the wall, they should also have a battery backup in case there's a power outage, because that's usually when there's more high risk of exposure anyway. And what do you do if the detector alarms in your home or facility? You immediately evacuate to outside to clean fresh air and call 911. And make sure all people, children, and pets are accounted for outside. And then can ask about symptoms, but really just worry about evacuating to outdoor clean air. Carbon monoxide detectors can be purchased at any home improvement store, Amazon. There are no resources in Pennsylvania that I saw for free distribution of carbon monoxide detectors, likely because they are unfortunately not required by law to have. There are you can get free smoke detectors from the fire departments, but not carbon monoxide detectors that I could find, unless you guys are aware of another resource.
I'm only aware that the Early Learning Resource Center over here in Pittsburgh, the ELRC 5, it was about, I want to say 2 years ago, that when a bill did pass about carbon monoxide detectors being required in childcare centers, they were giving out free carbon monoxide detectors at that point. But since then, I haven't heard anything, and there
That's true.
hasn't
I
been
did
any
see that.
update.
It was from, yeah, it was briefly, yes, but it
Yeah,
no longer is active, it didn't seem,
right, correct.
unfortunately.
So hopefully, I mean, it can
There's a
happen
point for
again.
advocacy here,
Yeah.
for sure.
Yes.
Because I did find when I looked up for the law in 2023, there was a bill brought to the floor in Pennsylvania to recommend this after a tragic incident in a daycare that I'll go through in 2022. This law was brought to the House, but then I don't see what happened with it after this. I think it got stalled in the state government. So this law, as far as I know, didn't get passed being brought up with the House Health Committee. So it's not currently a law. And so some incidents that you guys may be familiar with. In October 2022 in Allentown, Pennsylvania, firefighters were called to respond to an unconscious child. 19 patients had carbon monoxide levels in their blood 10 times higher than normal. Multiple people, including children and adults, were taken to the hospital for treatment. The cause was found to be a malfunctioning furnace. All victims were stable and everyone survived. Of note, the daycare did pass inspection a few months prior to this in July 2022, and there were no functioning carbon monoxide detectors in place in the daycare because it was not required by law. Of note, a mandate was passed shortly after this incident requiring carbon monoxide detectors in Allentown locally, and this was passed at the local level because the statewide bill requiring the daycare facilities to install carbon monoxide detectors was stalled in Harrisburg. And unfortunately, this daycare's license was suspended after this incident. And then just recently, on February 12th, 2025, in Maine, a daycare facility closed after after children and staff were exposed to carbon monoxide inside the building. All victims, fortunately, are expected to fully recover. The fire marshal's office said that the source of carbon monoxide was a propane-powered concrete saw that was being used in the building, but not in a different suite in the building. So they didn't even know that this was being used. This other suite in the building was under construction, not affiliated with the daycare at all. The carbon monoxide from the saw's exhaust infiltrated through the HVAC system. So there was no carbon monoxide detectors at the facility because they were not required. So that was another unfortunate incident. And so I found this fact sheet, summary sheet from the Pennsylvania Department of Health, specifically about carbon monoxide in childcare settings, kind of goes through what is carbon monoxide poisoning, the sources, symptoms, what do you do? And that's where I talked about the monitors, the detectors, and also making sure, obviously, children, when they're outside, are not being exposed to any gas-powered tools, obviously. And then there's some links here for the CDC, the Fire Commissioner, the Department of Health, and I also use the American Academy of Pediatrics as a resource for this talk. Does anyone have any questions? And these were some important websites with information about monitor detectors and symptoms, etc.
Well,
I
thank you,
think,
Dr. Rice. Oh, go ahead, Danielle.
Yeah, go ahead.
I was getting ready to say, thank you, Dr. Rice. My antennas went up when you talked about idling. So one of the things that we address when we go out to child care facilities to talk about promoting a healthy environment is we provide them with no idling signs. But I never made the connection between outdoor and indoor, right? You know how idling can be very dangerous indoor as well. Garages are not too common in the Philadelphia area, but there are some places that do have garages. So that's another reason that I put a star next to it when we discuss why idling can be so dangerous, that we talk about it in those ways of carbon monoxide poisoning. So thank you.
Yes, we
Yeah, I think
appreciate you being
the
here.
appliance maintenance and upkeep, the furnaces, people just don't, if it's working, they're not really, I've not checked any of my vents to make sure they're not blocked. It's really important to have that annual maintenance for all the furnaces and the appliances to make sure those things are vented to the outside properly, the stoves, etc. And checking the detectors every year to making every month to make sure that they're functioning.
So I have a question, Dr. Rice. So when you talked about appliances, I had a memory of when I was a child, right? And when we didn't have heat for whatever reason, my parents would open the oven to warm the house up, so that we're warm. We would sit around it.
Right.
And what advice would you give? Because I know families still experience, I know families experience it, right? They don't have any heat for whatever reason. So what advice would you give to a family who, they're turning on their oven because they don't have any heat?
Number one, is it vented to the outside? Because it has to be vented, otherwise you're, going to have that buildup of the gas and the carbon monoxide indoors. Having detectors. There are usually, I think I saw for the, the American Academy of Pediatrics gave some, the space heater tips, and then finding places to go where, like safety place, like if the power is out in the house, that's not a long-term solution, but when the power is out and your house is cold, to go to an identified place that's, to keep warm, to keep your family warm. That's temporary, obviously. Space heaters could be used, if there's not a central source of heat in the home, but also are a potential fire and carbon monoxide risk. So making sure there's detectors and venting to the outside. Some of those ovens might have been electric though, because we also see the gas flame on the stove being used, and that's also a fire and carbon monoxide risk. Yeah.
And I just would also like to add, luckily there are a lot of programs in place, so definitely would encourage families to reach out to places like we or other support systems in the city that may can help them. Philadelphia, particularly for Philadelphia County, like there is a law was passed that the gas company is not allowed to turn off the gas if you have children or elderly in the home during the winter months. So there are services out there to prevent that. Jermaine, I believe me and you are around the same age. So back then they didn't have those kind of things in places where families were more exposed to having to do that. But luckily we live in a state that have set up programs to prevent those type of things. So the biggest thing is to try to get the help before you even try to manage it on your own, because it's something that's really can't be done safely. Like if
Right.
you're trying to heat the home through appliances, it's
Not
just
what they're
not
meant
gonna
for. Yeah.
it's not gonna end well.
Thank you, Dr. Smasa, for it. I mean, that is absolutely the first line is resources. We write letters as physicians. We get them as a pediatrician to make sure that the family gets whatever letters and support they need to make sure that they have the power for the home to heat the home. And yes, we've been told by social work that they do not turn off the heat in the home in the winter when there's children.
Mhm.
Well, if there are no more questions, Dr. Rice, we really appreciate you taking the time
Yes.
to share with us all this information on carbon monoxide. And if anyone, if you would, are we okay to share PowerPoint with you with any participants, like a PDF version?
Yeah.
Okay.
Oh, yeah. I don't think I sent that to you, but yes, I can.
Okay, perfect. But yes, thank you again for sharing all this wonderful information with everybody.
Yes, thank you.
Yeah.
All right, so we are now going to move on. Dr. Danielle Samasa and I will be talking about air quality.
Okay. And you guys want me to jump off? Thank you.
Yeah, thank you.
Thank
Thank
you.
you.
Have a good one.
So I will go ahead and share my screen. Okay. Um, Let me just, because it's on this screen and I want this screen. Okay. There we go. Can everyone see my screen?
Yes.
Okay, perfect. So we are going to speak on air quality. Let me just gonna move this to the side. There we go. So first, Women for a Healthy Environment, our mission statement. So Women for a Healthy Environment empowers underserved communities to build resilience, promote equity, and safeguard children from environmental health hazards. We collaborate with families, schools, and early learning centers to create healthy environments where children can flourish. Guided by science, we advocate for policies and programs that foster equitable lives free from environmental harm. Women for a Healthy Environment also has three main program areas. We have our Healthy Homes program, which the wonderful Jermaine Patterson is here with us from that program. We have Healthy Schools, our Healthy Early Learning, and then we also have environmental health policy. So our learning outcomes for today, we are going to want to understand the importance of air quality in children's indoor and outdoor spaces, describe and apply the procedures for reporting identified health and safety risks in the environment, and identify ways to reduce exposure to indoor and outdoor pollutants. And then our agenda, we're going to discuss the effects air quality can have on health, how to determine whether the outside air quality is safe enough for outdoor activities, and discuss the differences between indoor and outdoor air quality. So I like to always start out with a nice little question. What is the difference between good air quality and poor air quality? So good air quality is the air that is clean and contains only small amounts of particulate and chemical pollutants. And then poor air quality is that the air contains high levels of pollutants and is often hazy and dangerous to health and the environment. So first, our air quality is always changing. When we are talking about air quality, we are talking about how clear the air is and about the small particles and chemical pollutants that are currently in the air we are breathing. And air quality is the air that is always moving and is always changing. It can change from day to day or even hour to hour. So that's why Women for a Healthy Environment, we really try to emphasize the use of the USA AQI, the Air Quality Index, which is EPA's index for reporting air quality. This tells us how clean or polluted the air is and what associated health effects might be a concern for you or the children in your care. So as I mentioned, air quality is described using the Air Quality Index. The Air Quality Index uses color-coded categories along with statements that share information about the air quality, groups of people who may be affected, and steps to take to reduce air pollution exposure. Air quality changes due to the direct result of both how air moves through the areas and how people are influencing the air. So as we see here, what affects air quality? Humans, ourselves, winds, and temperature. So with humans, most pollutants come from our activities we do, our vehicle exhaust, smoke from power plants, toxic gases from industries are just some examples of human-made air pollutants. The wind patterns move air pollutants around. So that's how the wind affects the air quality. This can cause more pollutants to be pushed at either certain times of the day or into certain areas. So I know sometimes we hear about wildfires that may be happening in Canada or California. Even though that wildfire is happening so far away from us, it can push all of those air pollutants from the fires into our area because the wind is always moving, the patterns are always changing. That's why sometimes we can have those effects on our air quality. And then temperature. So in the winter and colder months, it can cause exhaust pollutants to be trapped closer to the surface due to the dense cold air. And then with the warmer months, that's when the temperatures can disperse air pollutants more so. So air pollution that enters the air mostly comes from human-made sources. Common pollutants are produced from burning fossil fuels, our car engines, nitrogen oxides, volatile organic compounds, VOCs, and particulate matter, which is PM. So here you can see the air quality index basics. So on this little chart, as I mentioned earlier, you will see there are color-coded categories, the level of concern for each category, and the value of index and the description of how the air quality is at that specific value of index. So when we look at this and we look at the different values of the index, so we see 0 to 50, that would be seen as green, like you would see the AQ color come up green. Uh, the levels of concern are good, we don't have to really worry about that. It's when we get into more of that moderate, unhealthy for sensitive group, those higher values that we want to make sure that we are being careful, we're making sure we're checking the air quality, that's safe for children to go outside. So I do have a little video to play. It is about a little over 7 minutes, and it's just going to talk about the AQI color-coded categories. So I do want to make sure that my shares. Okay, there we go. So can we hear it?
Welcome to the Nano Training on the Air Quality Index, AQI. designed specifically for childcare providers and teachers. This training was developed by the Division of Environmental Health Epidemiology, Pennsylvania Department of Health, with resources from AirNow, a partner of the U.S. Environmental Protection Agency, EPA. Children's environments, such as where they live, learn, and play, may impact their health. Exposure to environmental hazards like mold, poor air quality, or contaminated drinking water can lead to negative health outcomes. Importantly, air quality may impact children's health because their lungs are still developing, posing a higher risk of developing respiratory illness like asthma. The objective of this training is to help you understand EPA's Air Quality Index, or AQI. Explain the AQI values and colors linked to air pollution levels, and demonstrate how these values may correspond to children's level of outdoor activities, as well as ways to include the AQI in classroom activities. So what is the Air Quality Index? The AQI is EPA's tool for communicating daily local air quality and is used as the basis for making air quality forecasts. Color-coded categories provide information about air quality in an area, which groups of people may be affected by poor air quality, and steps people can take to reduce exposure to air pollution. The AQI is a scale that goes from 0 to 500. The higher the AQI value, the greater the level of air pollution and the greater the health risk. EPA establishes an AQI for 5 major air pollutants, including ground-level ozone, particle pollution, also known as particulate matter, PM2.5 and PM10, carbon monoxide, sulfur dioxide, and nitrogen dioxide, each of which is regulated by the Clean Air Act and has a national air quality standard set by EPA to protect public health. Notably, AirNow's AQI tool only provides readings for ozone and particulate matter. The AQI is divided into 6 categories. Each category has a specific color corresponding to an increasing level of health concern. The colors make it easy for people to quickly recognize when air quality is reaching unhealthy levels in their communities. The first level is green. Here, the AQI value ranges from 0 to 50, and air quality is good or satisfactory with little or no health risk from air pollution. Next is yellow, with AQI values ranging from 51 to 100. Air quality in the yellow level is acceptable with moderate health concern. However, there may be a health risk for some people, particularly those who are sensitive to air pollution, including children, older adults, people with lung disease or asthma, and those who are always active outdoors. Then orange. At this level, the AQI value ranges from 101 to 150, and there is moderately high concern that members of sensitive groups may experience health effects. Next, red. Here, the AQI value ranges from 151 to 200. The air quality is considered unhealthy. At this level, some members of the public may experience health effects. Members of sensitive groups, including children and those with asthma, may experience more serious health effects. For purple, the level of health risk is very high, and the air quality is considered very unhealthy. The AQI value ranges from 201 to 300, indicating that there is an increased risk of adverse health effects from air pollution for everyone. This would include all staff and children at your facility. Finally, we have maroon. Here, the air quality is hazardous, with an AQI value of 301 and higher. This level indicates an emergency health situation where everyone is more likely to experience negative health effects because of higher levels of air pollution. You can monitor the AQI for daily air quality at airnow.gov. AirNow is a partnership between EPA, the National Oceanic and Atmospheric Administration, the National Park Service, NASA, Centers for Disease Control and Prevention, and tribal, state, and local air quality agencies. Additionally, EPA's AirNow mobile app provides a simple way to quickly check current and forecast air quality information. This information is useful for planning daily activities and protecting the health of your staff and the children in your care. The app automatically displays the current AQI for your local area or any area you wish to check, and allows you to store multiple areas for quick reference. The AQI can be used by schools and childcare facilities to modify outdoor physical activities. For instance, when the AQI is green, children can play outside without limitation, but when it is red or higher, outdoor activities should be limited. Air Now has a simple air quality and outdoor activity guidance for schools that can help you plan outdoor activities to protect the health of all the children you care for. Here, we provide some simple ways to include the AQI in your lesson plans and class activities. The AQI is simple enough for all children to understand. You can share the AQI with children during group times and let them make AQI color flags for display in the classroom. The different flag colors displayed daily would let everyone know how clean the outdoor air is. You can also read books about nature or climate. To help teach about air quality and specifically the AQI, EPA developed a children's book called Why is Cocoa Orange? The book is available free of charge, both in English and Spanish, at airnow.gov. There's also a narrated YouTube video of the book that students could listen to and follow along independently on a tablet or device, if available. Importantly, airnow.gov provides resources specifically for teachers as well as resources for participating in the Air Quality Flag program. Thank you for listening to this short training. Please do not hesitate to contact us at dehe@pa.gov or 717-787-3350 with any questions or ideas for learning more about air quality and the AQI. We acknowledge the U.S. EPA.
I hope that little video was very informative. Again, it provided all of the links that you can visit about airnow.gov, and of course, we can always provide those links. But as we continue, there is a short activity to do about air quality. We are going to skip that for now. So then why check the AQI? The importance of checking the air quality before engaging in outdoor activities protects you and the children from harmful pollutants in the air and know the amount of time that can be spent outside. So how to check the air quality? As mentioned in the video before, they're nowcasts. It relates hourly readings from air quality monitors to the air quality for ozone and particulate pollution. Nowcast updates during the day, which means you can check anytime before outdoor activities and find when a good time would be for the activities, if you can go outside, if you might have to stay in, do a little bit of flexibility, just to be sure that you're keeping yourself and the kids safe. So we are going to move on, indoor and outdoor air pollution overview. So outdoor air pollution outdoor air pollution is a complex mixture of pollutants originating from natural and human sources, including transportation, power generation, and industrial activity. Outdoor air pollutants contribute to the poor air quality in homes and schools. And indoor pollution is the presence of harmful pollutants in the air inside buildings such as homes, and the child care centers and family-based child care centers. So as we mentioned before, outdoor air pollution can be caused by car exhaust, local traffic patterns. As we know, during the day, there might be heavier traffic in the morning while people are commuting to work. Also in the afternoon when people are commuting home from work. Industry exhaust. Being in Pittsburgh, we are well aware of steel mills, things like that, pesticides, and smoking. And then indoor air pollution can be caused by dust, pests, pesticides, dampness, mold, toxic cleaning and building materials, and poor ventilation. So it is important to understand how outdoor air pollution affects us because outdoor air pollutants affect the indoor air quality. And since adults and children spend up to 90% of their time indoors, poor indoor air quality can interfere with student and staff performance and increase asthma and absenteeism. I do have another short video. This one is from UNICEF. It talks about air pollution and the health of children. So this one is a little less than 4-minute video, so it's a little bit quicker.
A poison kills 7 million people every year. 90% of children are exposed to it every day. This danger is air pollution. It threatens the health and development of children globally. Meet Gagan and Deepa. They live with their 3 children in a city in India. Ram is their youngest at 6 months old. Sunita is 5 years old. And Madhav is 12 years old.
We live near a busy road. Lately, our children have been coughing, feeling tired, and having trouble breathing. Some of our neighbors' kids have similar symptoms.
While assessing the children's health and exposure history, the doctor suggests that air pollution could be the cause. Air pollution can lead to respiratory and heart diseases, cancer, and impact lifelong health, including delaying brain development.
Children are particularly vulnerable to the effects of air pollution. You must take all steps to reduce exposure to air pollution inside and outside your home. For Ram, I recommend exclusive breastfeeding, and all the children need proper nutrition, adequate exercise, and should be up to date on their immunizations as preventive measures.
This information empowers the family to change their lifestyle.
Now we can check the air quality each morning and share what we learn with other families.
Mom lets me know when to stay inside and when it's safe to play outside. Sometimes we can't run around too much.
Deepa carries Sunita when they walk to school to avoid vehicle exhaust. When she walks Madhav to school, she finds new routes that have less traffic. From a public announcement, Gagan learns that burning wood, kerosene and coal in the home can be many times worse than outdoor air pollution, and begins buying clean fuel for cooking. He also learns that smoke from cigarettes, candles and incense can be dangerous to children's health. He now checks that windows and doors are open to improve ventilation when cooking.
We've been using wood and charcoal to heat our home and cook, but creates a lot of fumes inside. We're now switching to LPG gas.
I don't mind helping Mom cook anymore because it's not as smoky.
Deepa petitions local authorities to expand the recycling program and help the community reduce waste, improve disposal, and stop burning waste, especially close to where children live, study, and play. Gagan, Deepa, and their children understand that air pollution affects us all, no matter where it comes from.
The air pollution may not be going away immediately, but we can take these small steps to help our children. When everyone works together to protect our kids, we all breathe a little easier.
Gagan, Deepa, and their local health workers begin to advocate for policy change to protect their children's health from air pollution and empower others to do the same.
We still can't play outside every day, but my friends and I are not sick as much. I hope that the air gets better in our city and around the world.
Together, through action, we can protect the next generation and give them a clean, healthy, and sustainable environment to thrive in.
I like that video.
I know, I really enjoyed that one when I found it, and I was like, it really speaks on how important it is when everyone steps up. Even if you don't have children yourself or anything like that, it's always important.
Yes, and I wanted to point out something that's stated in the video when it talked about indoor pollutants that we wouldn't normally think of as a source of a pollutant, which was the incense, right? Or the fumes from cooking. So these are common things, particularly in child care facilities. There may be use of cleaning products or deodorizers, like plugins that are scented. These can be cause airborne particles that can cause irritants to children. So can you hear me?
Yes.
Okay. So just to think about those unusual suspects, right? Things that we normally would not think would be particularly harmful to indoor air quality, such as a plug-in or using Fabulosa as your cleaning product. Smells really great, but can become a serious irritant to children. So those, I love that the video touched on that, and I just wanted to take it a little bit further.
No, thank you for sharing. And up on the screen, we have just the infographic of children's exposure to air pollution. As Dr. Rice mentioned during her talk on carbon monoxide, children are a vulnerable population because they're breathing faster, their lungs are still developing, they're closer to the ground, weaker immune system. So that's why we just want to make sure that we're keeping the children safe. And when we check the air quality before going outside, that's another way we can make sure that the children are staying safe. So we had another little review game. We're gonna skip right past. We are gonna skip past our break time as well. And then we're just going to do a quick review of sources of air pollution, and then I'm going to pass it over to Dr. Danielle Samasa. So just a quick review. The causes of air pollution, we have natural causes, the humidity, dust storms, wildfires, and then we have other causes like the emissions from the vehicles, industrial emissions, household emissions. Yeah. So now I'm going to turn it over to Dr. Danielle to finish us off.
Okay, and so we'll be moving into indoor and outdoor air quality overview. So again, indoor air quality. When we talk about indoor air quality, we are referring to the air quality with and around the building or the structure. So everything that is inside your facility or your home is and with the air that you are actually breathing is what we're talking about when we refer to indoor air quality. Toxic fumes from products around the house can contribute to poor indoor air quality, volatile organic compounds. So, as I stated, a prime example, something that we can relate to is the use of scented products that can contribute to indoor air quality. And their indoor air pollution health effects. So as Paige mentioned, children, they are when we are all children, this is the most time that we are the most intimate with the physical environment, right? So children, not only are they closer to the ground, but they're also, and they're touching. This is how they learn about smell and feel. So they're constantly touching things. They're constantly putting things in their mouth. They're constantly smelling things, and all those things can be very sensitive to a child as their bodies develop and these major organs develop, such as their respiratory system, their lungs, right? All that can play a very serious relationship between the environment and your body. It's the most serious time when you are a child just because your body is developing, your organs are developing. Exposure to indoor air pollutants may include symptoms such as coughing, eye irritation, headache, shortness of breath, sneezing. And when you look at this list, a lot of it sounds like maybe seasonal allergies. I was at a childcare facility And they didn't make the connection that the products that they were using were causing irritants that mimicked seasonal allergies. But they realized that the children weren't necessarily sick, but they always had the sniffles. And it can easily be because of a plug-in or the products that you are using, or that there's something else that's going on where your indoor air quality is not good. Individuals with asthma, respiratory diseases, and suppressed immune systems are particularly susceptible to the effects of indoor air contaminants. As we know, children with respiratory problems, particularly asthma, uh, RSV, chronic bronchitis, these are things that we are seeing high increases of, particularly in populations in urban areas. So again, these are all things that particularly make children more vulnerable when the indoor air quality is poor. So, how can outdoor air quality affect indoor air quality? And we talked about it earlier. Paige did a good job at explaining how, outdoor can carry on into the indoor. And all looks look great, but I want to talk about some more ways that it could be relatable, such as why we promote, say, walking mats, right? We promote that child care facilities have walking mats at their entrances, because that is a way to stop the bad stuff that's outdoors from being trapped into the indoor and making that air quality poor. Idling is another big thing. When a car's idle, parents keep the cars running as they run in to get their kids, or you live in a high traffic area. Those fumes from cars' exhaust can contribute outdoor air quality, can those bad things in the outdoors can contribute to poor indoor air quality. So it is something to just be more conscious of how you can improve the immediate outdoors, and make that environment safe so that your indoor air quality can be safe as well. I have another example of a child care facility I went to that was right across from a high school. So you can imagine when school let out and the bus stop was right in front of the childcare facility. So you had teenagers smoking all sorts of things right in front of the childcare facility. So having simple signs of no smoking, right? Uh, Paying attention to the immediate area right outside of the child care facility was going to improve their indoor air quality, just making sure that things were correct outdoors. Next slide. Outdoor air pollution health effects, very similar to indoor uh, air pollution health effects: coughing, wheezing, chest discomfort, ear irritation, burning feelings in the lungs. It's the same for both. So that's why we need to pay attention to both sides. Next slide. Children's health and air quality. When we talk about air pollution in young children, they are the most vulnerable out of any other group of people. As I used to tell my clients when I did parenting, they are little people, right? They're like us, but everything is smaller. So because everything is smaller, it makes them more vulnerable. Their organs, their lungs, all these important things are still developing. So it just makes you more susceptible. Young children have smaller airways than adults, and their airways are still developing, as I just stated. Growing up and breathing high levels of air pollution can affect how children's lungs develop, putting them at a greater risk of lung disease as they age. So what can I do? Outside the center, as I stated, one, you want to make sure you have those signs up. No smoking, no idling signs. Those are things that you can do. You can have walking mats. That is something that you can do to cut down from bringing the funkiness from the outside into the inside. Decreasing the amount of air pollution that enters the center, again, the walking mats, and protecting yourself and the children you serve by checking the air quality before outside activities. We all have smartphones. We can go right on. There's apps. There's websites that you can easily go on to check the outdoor air quality. One of the good things that did come out of the wildfires in Canada was to wake people up really about how outdoor and air quality can affect us all. Inside the center. So open windows, let's talk about that first. Here in Philadelphia, open windows, particularly in childcare facilities, are not a common practice. Most facilities keep their windows closed and they're sealed. They're actually not operable. But if you do have operable windows, you just want to make sure that one is safe, right? But that the windows are not facing high traffic areas, right? If they are, then you want to make sure that you have them closed during those high traffic times. But if you can safely open up a window, there's nothing like fresh air to ventilate a building, right? So if that is, you can do that safely, keep your children safe and your staff safe. We always recommend have that fresh air, take advantage when it starts to get warm, and that you can open up the window and you can use fresh air to ventilate your facility. Avoid air fresheners and candles. Candles are not so much prevalent, but those air fresheners, right? Those plug-ins or the sprays, you definitely want to avoid that because they can cause irritants to children, particularly children who are vulnerable because they have some type of respiratory issue. Choose natural cleaning products. You want to look for the seal. If there is a natural cleaning product, it'll have a sticker on the disinfectant or the multi-purpose cleaner, and it'll say either safer choice or it'll say EPA certified. That is what you want to look for. And actually, you can buy a lot of these products off of Amazon. You can go to a lot of the larger Dollar Generals actually sell products with the safer seal choice. So that is something that you can look out for when you're buying products to clean your facility. We want you to stay away from things like bleach. We understand that bleach is cheap to use, and we understand why people do use it. If you find yourself using something like that, remember you are dealing with a product that has some serious chemicals in it, right? It's something that you can easily smell. So you want to make sure that it's diluted properly with water. You want to use cold water. Don't use hot water because that releases more fumes and you knock yourself out trying to clean your floor. So make sure you use enough water, cold water if you have to use bleach to clean your facility. But try, if you can, to buy natural cleaning products with the EPA or Safer Choice seal. And also, I know that it's mandatory to test for lead and radon, but you want to make sure that you are testing as regularly as called for to make sure that your radon and lead levels are okay. So resources, the why is cocoa orange and why is cocoa red are great resources through the APA that talks about air quality, and it has this whole thing with flags, the air quality index. This is something that we provide to child care facilities. We actually have the posters and the storybooks and the flags that you can use. In each day, you'll put the flag up that describes what the air quality index is for that day. And luckily, we have been in the green for a while now, which has been really good. Of course, as we stated, having those no idling signs and no smoking signs are really important, and that is something also that we can help you with. And these are some further references for your information.
Thank you, Danielle. I am going to stop sharing right now. Open it up for any questions. If anyone has any questions they would like to ask.
And I just want to give a final remark before we move into our last part of our presentation. Dr. Rice reached out, and we just want to be clear that for anyone who is watching this video, if your facility or you know of a parent or for yourself and you're having issues where you're not able to heat your home properly due to financial issues or other issues, please, 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 before you try to address this problem on your own, that you first reach out to your local support service agency or even we to help you with trying to find a safe solution to heat your home.
All right, we are now going to move on to Jermaine Patterson, our certified community health worker here at Women for a Healthy Environment. And I'll let Jermaine take it from there.
Thank you, Danielle and Paige. So I'm going to share my screen. Hopefully, I always have trouble with this, so I'm going to warn you all. There. You see my screen yet? Can you see it yet?
Not yet.
No.
No.
Lord, I think I just X'd out of it.
Jermaine, would you like me to pull it up?
Please.
Okay, I can do that.
And
Not a problem at all.
I swear I practiced.
It's hard. There.
Awesome. Thank you so much. So as Paige mentioned, I'm Jermaine Patterson. I am a community health worker with Women for a Healthy Environment. And I am in the Healthy Homes program. And so what I will share is more specific to healthy homes and also the Paige mentioned before, a lot of what I do is advocacy work. So I'm going to share a little bit about our Healthy Homes program. And I'm also going to share about some of the advocacy work in the area in which I work and live in. So unfortunately, right now we are only, well, our program, our Healthy Homes program is only in Southwest PA, specifically in Allegheny County. And under our Healthy Homes program, we provide healthy home support and resources. We have a Healthy Homes asthma program. We provide community support and education, and we also have workforce development. So just to give you an example of what that looks like, the support and resources, what that looks like is community health workers. One of the things that we do is called a healthy home assessment. And with the healthy home assessment, we schedule time with the family. And what we do is we do basically a walkthrough. And with that walkthrough comes a checklist. And we are actually helping those families determine if they have any potential environmental exposures inside of their home. Danielle mentioned earlier that we spend a lot of time indoors. So when you think about the children that you are serving, they are either with you or they are at home, especially during the winter months. Next slide. So when we go to homes, these are some of the things that we look at, and you can call them unhealthy homes culprits. And it's similar to what, could be in a child care center. So we look at products that a family may have in their home. Mold is a huge one. Mold is really huge inside of homes. Lead, that's one of the things I know in the early learning space. Lead is something that we look at as well. Pest, and also radon. So radon is similar to carbon monoxide, but not the same. Radon is odorless and colorless. So that's one of the things, or one of the hazards that can be inside of the home. As you can see, I have air quality I have it in bold because all of these have something to do with air quality, right? All of these things. Mold, actually, I do want to point out with mold, it's actually a trigger when it comes to asthma. And so if there is a child in your center, mold is actually a trigger for an attack. So that's something you really want to pay attention to inside of the child care center. If you have a child, it can be actually harmful for anyone, but particularly a child or an individual, even an adult that has asthma. Next slide. So these are the health impacts. So Women for a Healthy Environment, we are a public health organization. So we are concerned with the health, right? We are concerned with health of families, individuals, whether they be from zero all the way up to elders. So these are some of the health impacts when it comes to environmental exposures. As you can see, cancer, cardiovascular disease, diabetes, mental health, neurodegenerative diseases, reproductive and birth outcomes, and respiratory disease. And as you can see, I have in bold in asthma in bold print. Just some statistics. In Pennsylvania from 2011 to 2019, adult lifetime asthma prevalence increased from 2.9% in 2011 to 15.8%. And I'm sure those numbers are even higher now. And then when it comes to children ages 10 to 14, had the highest 3-year average lifetime asthma prevalence of 18.2%. Next slide, please. So these are the steps that we can take as individuals when it comes to our homes, right? Child care center is one thing, but when it comes to our homes, these are some of the steps that we can take. We can leave our shoes at the door. When it comes to dust, you always want to wet dust and not just dust freely. What that means is spraying whatever product you are using. Hopefully it's just baking soda in water or baking soda in vinegar and not some of the products that are on the shelves. What you want to do is you want to spray the actual rag that you're using and wipe that way. And because when you're just dusting, it's just flying from one place to another, and you are actually inhaling in that dust. You want to change your filters, your HVAC filters frequently. You want to keep your humidity levels at 50%, so not too hot, not too cold. A lot of our senior populations, they have a tendency to get cold. So they may have their heat up really high in the warmer months. And so that can be unhealthy. You want to check for any leaks or moisture. And that is because mold, I mentioned mold earlier, mold actually thrives on dampness and wetness. And so you want to make sure any areas of your home or your child care center is actually free of moisture. And what that looks like, a leaky window. Could be a leaky window. It could be leaks under your sink, whether it be in your bathroom or in your kitchen. And when it comes to your bathroom, if you don't have a vent, you want to make sure you open up your window so that some of that warmth will escape when you're taking a warm shower. Radon, I mentioned radon briefly. It's similar to carbon monoxide. You cannot smell it. You cannot see it. It's odorless and colorless. The difference between carbon monoxide, one of the biggest differences is that radon is a natural occurring gas. You want to keep your home clean and use safer cleaning products like vinegar, baking soda, hydrogen peroxide. You want to seal any holes in your home to keep pests out bay. In the winter months, pests like rodents are more prominent. They are just trying to keep warm. And so you want to make sure you seal any homes. And Danielle did mention this earlier, and I think Paige also mentioned it. The use of VOCs can be harmful. So you want to make sure you are not using those things, especially in closed-in areas, things like glue, crafting products that are, used in child care centers. And then also, lastly, you want to make sure that you are avoiding products that are made from particle board, pieces of furniture, because they have and also flame retardants as well. Scotch guard, things of that sort. Those are flammable products. Next slide. Okay, so why am I showing this picture? So this is actually an industry that creates harm, that is actually, it's called U.S. Steel Coke Works. So I'll be transparent, U.S. Steel Coke Works. And it is actually the largest Coke facility in the United States. And it actually lives in Clairton, Pennsylvania, which is in Allegheny County, Southwest PA. So this is where I and a lot of community members live, and I actually work. But I just wanted to show you this. It looks like a city within itself, and this is not even the extent of the size of U.S. Steel Coke Works. This is just a small portion of it. But that's it at night. I want to mention that When we are sleeping, this is what's happening. When we are awake, this is what's happening. But the one thing that for me personally, and I'm sure for a lot of others, is that when you are asleep, this is something that can wake you at 3 o'clock in the morning because of the smells. Next slide. So why am I mentioning this? Because it is industrial pollution that harms communities. And Clairton, Pennsylvania is just one community that is being harmed by industrial pollution. And I mentioned some things that make so some of the things that I have listed here. So one thing is that Clairton is an environmental justice community. The population in 2023 was almost close to 6,000. The poverty rate is almost 30%. 12.6% of the population under the age of 65 are not insured. It is a food desert. And also, there are approximately 4 childcare centers here. So I did want to mention that because of who possibly would be listening to this. So if you just, paint a picture of this community that is being harmed by industrial pollution, and then you have these other things on top of that, not having a grocery store. The poverty rate is high, which means there are not a lot of jobs. Next slide. So this is a lot, and I will read some of it. One of the biggest things that I did want to point out here is that in 2018, a sample showed that 18.4% of 213 Clairton Elementary School students in the ages range, the average age range was almost close to 8 years old, are diagnosed with asthma. And that is approximately 3 times higher than the national average of 6.5%. So allow that to sink in. So you have close to 19%, 18.4% of children in one particular community that has asthma, which is higher than the national average. 3 times higher, not just 1 times higher, but 3 times higher. So these children are being exposed to industrial pollution on a daily basis. And just because it's outside and they are spending a lot of time inside does not mean that they are not being exposed. Because I can tell you from my experience that I can't open my door. I can't open my windows. Danielle mentioned earlier, opening your windows for some fresh air. The air is not always fresh air. So opening your window in the spring, which I love to do, you can't always do it because that pollution is coming in and it's going to be trapped inside. Another thing that I want to mention here is that according to the CDC, in 2021, 12.5% of Clairton adults lived with asthma. And all of these statistics that I have on the screen are related to this particular community. The heart disease is higher. Clairton has ranked number, oh, I have some typos here, I apologize, has ranked, it's higher than 48 reporting municipalities within Allegheny County. when it comes to cardiovascular disease or stroke. I'm going to have to fix that, but I apologize. That is a typo there. Next slide. So this is a couple lived in Clariton all of their lives. At least I know the gentleman has. Mr. Art. Mr. Art is actually an advocate. He's a clean air advocate. Unfortunately, he just lost his wife this past week, this Friday, and Miss Catherine had sarcoidosis. Sarcoidosis is actually a disease that is linked to coal byproducts. So here we are in this community being exposed to coal, right, which is being burned in furnaces. And this is a result of what happened. This is what happens. Community members are exposed. And unfortunately, some of them, it is the cause of their demise. Next slide. So, as an advocate, this is what we need to change to protect the health of the environment. This is not limited, but these are some of the things that we need. We need accountability from public powers and private companies. We need to obtain resources that will help to protect residents. One of the things that Women for a Healthy Environment does under our Healthy Homes program is that we do provide air filters for residents who have children with asthma. So that is one way that we are helping to protect our residents. Reduction in pollution and greenhouse gassing. We need more tightening of coke oven regulations. We need a local air warning system. There was a fire in 2018, and residents were not aware of it until over a week, almost 2 weeks. And as a result of the fire, a lot of people ended up in the emergency room. A lot of children ended up in the emergency room. But we were not warned. We did not know until I believe it was 12 days later, which is it's unacceptable. It really is. Increase real-time monitoring, fence line monitoring. So what that means is having an air monitor around the facility, not just in one spot, 2 spots, but around the whole facility. Because the facility is large enough that there are several communities that are around the facility. And also increase permit fees. And what that means is that there are so industries that pollute have to pay a fee. And so we need to have that fee increased. Next slide. So creating change. So this is just a list of some of our collaborators. These are organizations that we actually collaborate with. We meaning Women for a Healthy Environment. And as you can see, I have us listed first. There's also SenSWAPA, and that is Cancer Environment Network in Southwestern PA. The Breathe Project, Valley Clean Air Now, which is a local grassroots organization that I am also a part of. Southwest PA Grassroots Town Halls. We have been having town halls since the pandemic, actually, and they have all been virtual. I am also a part of that organization, Clean Water Action, Clean Air Action, Environmental Integrity Project, Create Lab, 412 Justice, Environmental Justice of Greater Pittsburgh, and Black Appalachian Coalition, which we have recently started to collaborate with. And I will provide the websites for all of these organizations if anyone is interested in looking into them and also supporting these organizations who are helping to protect community members, residents from horrible air quality. Next. And that's me, and I want to say thank you for your time. I will provide these slides to Paige so that she can share them out.
Thank you so much, Jermaine, for sharing that with us. Does anyone have any questions for Jermaine?
I just wanted to
am-
briefly
Yeah, go
say
ahead.
that the slide that Jermaine shared, although it was talking about individual homes, those steps can easily be applied to a childcare facility. So as people view this video, really think about it and how you can, if you're a provider looking at this video, those steps can easily be applicable to your site.
Right. And as I mentioned earlier, unfortunately, our Healthy Homes program is only in Allegheny County, Southwest PA for now.
For now.
Yes.
Keyword. So I'm going to share my screen one last time, do some final remarks, and we'll send everyone on their way. So here I just want to share our Healthy Childcare Champions QR code. Our Healthy Childcare Champions program works with early learning centers. I work with Western PA more so. Danielle, being in Philadelphia, she works with the southeastern and eastern parts of PA. As a Healthy Childcare Champion, you are working towards creating an environment for your childcare center, whether that's a center or family-based, to decrease environmental factors and create safer environments for children. And then we have our 1,000 hours a year program. Kids spend about 1,000 hours a year in childcare and schools. That's why the program is called that. So that's where we're here to protect the children. Through this program, you can get lead and radon testing and remediation through mini grants ranging between $500 and $5,000. If you have any questions, Sam Hernandez, she is located in Pittsburgh, Pennsylvania as well. Her info is down there. Unfortunately, this program is only for Western PA. Again, we are working on getting it to more up to the other part of Southeastern. Just as a note about that and the QR code for the form. And then a nice little thank you with more information shared on this slide. And we thank you all for joining us today.
And I just wanted to say really quickly a little bit more about the Healthy Childcare Champions program. That is, Jermaine talked a little bit about the steps that are taken when under the Healthy Homes program, as far as a checklist, going into the home and seeing how we can help to promote a healthy environment. It's the same for the Healthy Childcare Champions program, where we will go in to a childcare facility. It could be home-based or center-based. It could be here in Southeastern PA, and we will walk you through the process of promoting a healthy environment for you and your school community.
Well, thank you, everyone. If there's no other questions, I'm going to stop the recording.
Thank you.